Who here has taken a practice exam yet? Everyone has taken one. Okay, right. So here's the situation, right? You can take a practice exam and not know what a passing score is, right? You can take the practice exam and not really know how many questions there are on the exam. Who knows how many questions there are on the exam? 200. Right? We're all over the place, right? So all of these information should hopefully be solidified for you, right? That's our very first step. I think of the NPTE as a game, right? We're playing a game to win. So don't worry about a whole lot of other stuff. All you have to focus on is how do we win this game and become certified, right? Any questions before I go on? Anything about me? But we'll have plenty of time to answer that later on. All right.
Where'd you go to school?
NAU.
Right.
Yeah, Phoenix campus. You're talking for grad school, right?
Yeah.
Okay. Yeah, so, yeah, a little bit about me, I guess, will help. Like I said, I teach for DPT programs and also PTA program as well. So I'm familiar with all your coursework and stuff you guys have to go through. Currently, you guys are towards the end, right? Mm-hmm. Clinics?
Yeah.
All right. How's that going? Busy?
Busy.
All right, you guys are almost there. So this is the final step, right? So my goal is to get you over this hump and get you into the clinic, start getting paid, right, to do it instead of doing it for free, right? So yeah, so that's my background. I went to NAU doing some teaching and I also practice. I specialize in cardiovascular and pulmonary physical therapy. So I know that's an area that a lot of people have trouble with. So if you have questions with that, I'll be more than happy to help you with that, okay? So the agenda for today is to go over the NPTE. First, we're going to go through the structure of the exam, what it is, stuff that you should expect. And then we'll go over some sample questions and analyze that. We'll talk about how do you analyze the questions that you're going to see. And the goal here is to simplify the process, right? And make it very easy for you to navigate. So who's seen this meme, right? So this is what the NPTE could feel like. There's just so much stuff to do. You become overwhelmed and you actually end up not doing something. Sometimes you're like, all right, I'll just save it up for the next day, or I can't do this right now, it's too much, right? Who feels that way? Who gets like that, right? So one strategy that really helps is to just break the NPTE down, the studying practice, all that you're going to do, simplify it, and it makes it a lot easier to handle instead of trying to take it all at once, right? So those moments where you just have to step back, take a breather, and come back to it. So that is my hope, to create a system for you guys. And the goal here, and the key here, is consistency, right? It doesn't matter if you get a really good score once. If you cannot replicate that, that's not very good, right? You want to be able to score consistently each time that you're taking the practice exams. And if you do bad once, that's fine, right? It's what you do more consistently. And my approach focuses on 3 areas. Efficiency, so that means that we're not going to spend time on activities that don't get you to a better score, right? Everything we do has a specific goal of getting you to a better score. So we're going to choose activities that will boost your score the highest possible. And then secondly, I work with specific goals in mind. So our goal is to get results, right? If it does not get results, we don't care for it, right? And then lastly, results are what matter. Once again, results. I don't want you guys spending a lot of your time. You guys are busy. I don't want you spending time doing activities that will not get you to a better score. So we're going to have defined goals, and each activity we're doing is going to help get you to a specific area. Sort of today, like today. The goal for today is to get you more familiarized with the exam and hopefully get you better with answering some of those questions, right? Any questions so far? So, well, I guess I'll see your averages for what you guys, does anyone want to share how they did on their first one? It's fine if you don't. Was anyone happy with their score?
I mean,
Surprise.
I think it only for the first time.
Mm-hmm.
found, I know that there's like a particular section that I got really high on, and then the other sections I did, evenly across the board, but the one section was like way higher than the rest of them, which was kind of surprising to me.
Yeah, and I think that's very accurate. Surprise, it's a surprise, right? It's a shocker, first of all, like, ooh, okay, I don't remember going over any of this material, or some of it might seem easy, right? So like you're saying, you score well on some portion and then the others. Newsflash, a lot of students don't pass their first one, so that's fine, right? That's why I said it doesn't really matter what that first one is, it just matters what you're able to do more consistently, right? And with the NPTE, it doesn't really matter how much you know, and my goal is not to get you guys to be knowledgeable, it's to get you to pass, right? If honestly there was a way to pass the exam without you knowing anything, I would teach you that. But unfortunately, you need to know stuff, right? And this boils down to one point, because people get caught up on thinking, oh, I don't know this stuff, right? Or they're trying to learn something that, yes, it's good, it's going to help you in the future, but it doesn't really matter, right? And some of you guys might be really smart, you've been doing really well in the program, and it's a shocker when you take the NPTE, right? There's a strategy and tactic to taking it that doesn't really matter based on what you know. And sometimes that's actually a negative, because people know so much, they overthink it and choose the wrong answer, right? So how well you do depends on how well you can answer the questions. So that's where I come in. Someone like me, I'm coach, I will teach you guys how to take the exam. I will find strengths that you have and focus on those strengths and try to build those. And then I'll also find weaknesses that you potentially have, areas that you're making a mistake, and teach you how to avoid those, right? And then I'll also be able to help you refine your knowledge base, because like I said, you do need to know some level of information for the exam. You don't need to know everything, but you do need to know something. So our first strategy is to get to know the exam, which is why we did that pre-survey, just to see where we're at. So once again, this should help clarify the information, right? We should all be knowledgeable. And if we know this, it'll prevent us from making silly mistakes, right? And the NPTE is a standardized test, so it's different from the other tests you've been taking. It has to be broadly applicable for everyone all throughout the US who's taking the exam. So it's not based on what you're learning at Gateway or what you learn somewhere else in the clinic. It's a standardized exam. And it's to assess your knowledge, right, as an entry-level physical therapist assistant. So with this being said, if it's not in your textbook, don't even bother to look at it, right? Textbook material, everything has to be able to be referenced back to the textbook. If you learned some information in the clinic, that's great. That will help you treat patients. But don't use that information to answer these questions. That's not where they're getting their information from. They're getting it from the textbook. So that's where you need to go to find all that information. And this is the outline for the NPTE. On test day, there's going to be 200 questions, and it's divided into 4 sections. And you're going to have 50 questions for each of those sections. 150 of those questions are graded. So 50 are actually not going to be graded. Did anyone know that?
Yeah.
And you will not know which ones are graded or ungraded, so you have to answer all of them like they're being graded, right? You will have 4 hours total, which comes out to be about 60 minutes per section. So I say about because it's self-paced. Did you guys know that also? All right. So it's self-paced. You have 4 hours total to complete it. If you spend 3 hours on one section, you can do that, but then you have 1 hour to finish the other sections. You get 1 scheduled break. Who knows when that scheduled break happens?
After the second section?
After the second section. After the second section, the time pauses and you get a break. But you can take unscheduled breaks after you complete a section. Clear your head, step away from the exam, whatever you need to do. But during those unscheduled breaks, the time is going to still keep running. So if you're someone who has trouble managing time when you're taking an exam, this is good information to know because it lets you know, or if you need a lot of breaks, right? Some people can't sit for a long period of time, so know when those breaks can come. And maybe you work a little bit quicker so you can get a longer break if you like to have long breaks on those unscheduled periods, right? So we know how many questions there are, we know the time limit, and also how many breaks we get, right? Let's talk about the score. We have 2 scores you're going to get. The raw score, that is just the number of questions you get correct, the actual number. But what's going to be reported is the criterion-based score. So like I said, it's a national exam. They're going to take all the scores and put it on this scale of 800 to see what your score is. And based on that, that's how they'll determine if you passed or not. Who wants to tell me what the passing score is for the NPTE? What is it?
600?
600. You've been reviewing all the material, I see. What's your name?
Jana.
Jana. All right. So that comes out roughly to be this. If you're taking the practice exams, you need to get 95 to 108 questions correct. And it's a range because each year it's different. Some years it might be lower depending on how hard the exam is. Some years it might be higher because the exam is easier. So if you're scoring between 95 to 108, that should roughly place you at the 600 or greater category. So what does that translate into? You need to be able to get about 63 to 72% of the questions correct. Riddle time. Who wants to answer this?
Nothing about that.
Thank you. Nothing. They're both PTAs. Guess what? This is the first step, not the destination. I don't want you guys to get caught up on this exam. Like I said, it's a game. Beat it, move on. Fun fact, no one will ask you for your score once you become a certified PTA. Now, this doesn't mean that I want you to, this doesn't mean that you shouldn't try your best. If you get an 800, you score the highest, great, congratulations. But don't get caught up. Your future success as a PTA will be determined by what you do afterwards, your commitment to the profession, your involvement, and all the things you're going to do to become better, right? So I want you guys to focus on that and not get beat down so much by this exam, thinking it's a reflection of what you're going to be as a future PTA, right?
It's kind of like your ticket, right?
It's your ticket, yeah, entry ticket, right? All right, so our next strategy, get to know the rules. So what to expect on the exam day, and we know what that will be, what the questions will look like, or how many questions there will be, but now what will the questions actually look like? So I put one question on there where it asked, what type of question would you expect to see on the NPTE? Who wants to tell me an answer for that?
It's one answer, right?
Yeah, one answer.
Per question.
Exactly. There's not going to be any fill in the blanks, no essays, no matching, right? It's all going to be multiple choice and there's going to be just one answer. There's not going to be option A and B, none of those, right? So just one answer. It's going to seem like a lie because you'll swear there's multiple answers to the question, but there is one answer to each question. So that's very important to know. And then this is the outline. And what you'll see here on the left is the specific topics and the different systems here. And then you're going to see the number of questions, the ranges here. And then this is the percentage of the test that will actually have those information. So what you should really pay attention to here is that these three are going to make up 70% of your exam. So strongly recommend, be comfortable with those. This is good information to know, but look at how many questions, right? So if you're focusing so much, you're like, I didn't remember when we did lymphedema. Like that was my hardest part. I'm struggling with it, and you spend so much time studying lymphedema, right? So, like I said, maximize your output. Don't spend time doing things that are not going to get you the best result. And then we can see here some other outlines here, right? Has anyone seen the content outline yet? Right. So one of the links will have that for you. So modalities, if you felt terrible with modalities, good news, right? It's not a lot on there. Still review it, right? But it's not a whole lot. And then here we can see that breakdown for the different systems, specifically what areas they're looking at. So data collection. So for MSK, that's going to be range of motion, manual muscle test, interventions, right? Different types of interventions you can do for those systems, aerobic capacity, all of that. So you can see specifically what information you should be studying. This is good news, right? Because it's not, you don't have to spend your time stressing too much. They tell you exactly what's going to be on there. And people forget to look at this part. They're literally telling you what you need to go over, but people don't look at this part, and it ends up, just causing them to have silly errors. So now that we kind of know the structure, we know the game, right? Let's get into the actual questions. So when we're looking at the practice questions, we have to see our approach first on how do we analyze the questions, right? So there's 3 steps to analyze the questions. The first part, you're going to have to underline what the question is actually asking. That is called the stem. And then the next step is to circle any information that helps you understand the stem better. And then step 3, I want you to think of a possible answer. So this is your first 3 steps that you're going to do with each question. Once again, we're building a system. Normally you read a question, you just jump, you start, sifting through the options, right? To try to find an answer, right? So what I want you to do is follow this, because a lot of what will happen is you will miss a lot of questions where you're like, oh, I knew that, but you still got it wrong, right? So what happens is a lot of people forget or they miss the stem. That's a big part, to understand what the question is actually asking. And then the second step is just to help you out, right? Because sometimes the question might be very easy, so you guys went through those first couple of questions pretty quickly, but then for that last one, it took you all a while to complete that. So if you're struggling with it, this step 2 could also help cue you in on what the question is asking. And then to think of a possible answer, let's focus on that part, right? So with this part, if we think about a possible answer, it keeps us from making a lot of mistakes. So I want you guys to just think in your heads, what structure pumps blood to the organs? Just think of it in your head. So hopefully we all thought of an answer pretty quickly. Who wants to give me an answer? The heart. Okay, so we thought of an answer pretty quickly. And what this shows you, it's a very simple question, right? But what this shows you is what you actually know. So if you can come up with an answer when you read the question, that's great. It shows that you actually understand the topic. If you cannot come up with an answer after you read it, it means you don't have a good grasp of the topic. So those questions you read, you don't know what it's asking and you can't come up with an answer, that's a knowledge gap, right? That means you need to go back and study that. If you read it and you're like, I think it might be this, you have a grasp of the topic to a little bit, right? But you need to work on that a little bit more. So that gives you a gauge on how well you understand the topic. The second part, it keeps you from getting caught up on distractors, right? So here, if we look at the options, what do we think about the options? Is there any competent answer here?
No.
So sometimes it's that simple, but we can get caught up when it's that simple and we might miss a better option sometimes. And people miss questions oftentimes because they don't read all the options, right? So you need to be able to read all the options even if you come up with your answer. But the benefit also, it shows your understanding, but when you think of that answer and boom, it shows up right there, that's great. You should feel confident, right? Like, oh, that's definitely the right answer, right? And it's usually a high likelihood that that's what it will be, but you still need to go through it. So how about this? Question hasn't changed. Think of an answer. So when I asked you guys initially to come up with an answer to this question, who came up with any of these options? You did?
Yeah.
The first time?
Yeah.
All right. But not everyone, right? Most people are not thinking in this level, right? Sometimes the question might be that simple where it's on a very basic level of understanding. It's not that you don't understand what the question is asking, but you understand it to the depth that they want you to understand it, right?
Yeah, I felt like it was a vague question.
It's vague.
Yeah.
And sometimes it might be like that, right? But you still came up with an answer that's going down the right track.
Yeah.
You should not be thinking
I was in the right.
very
yeah.
distant, right? But that's why I say that's the first step. You need to understand where's your knowledge base at. And then you read the questions, right? You come up with heart, you don't see the option there, you freak out. Sometimes, right? This one's pretty simple, but sometimes you might freak out because it's like, oh, maybe I don't know this. But I'm going to show you guys how to navigate through this and to be able to calmly find the right answer. So who has an answer for this? Ventricles, right? So if you don't have a good grasp on the anatomy of the heart, you might get tripped up here and forget what part does what. This question, why it's different, right? Obviously the options, but the difficulty changes based on the options, right? So same question, difficulty is changed now just because we have different options. It requires you to actually understand the anatomy of the heart, right? So not just the structure in general, but then boiling it down to what those actual sections are doing. Any questions on that? Okay. So now we're going to then see how we can narrow down our options. So I already mentioned this part. The very first and most important rule, you have to go through all answers. Go through all the options. Do not just be like, oh, that's mine, click, move on. It's going to take you 5 seconds to go through all the options. Don't miss points because of a silly mistake, right? One of the worst feelings you will get is if you miss the NPTE by 1 point. Squeeze out every single point you can get, right? If you go through all those answers and you see your answer is still the best fit, then take that and move on. And it's likely correct, like I mentioned. Everyone has different ways of approaching it, but my recommendation for students usually is don't come back to the answer you're pretty certain about. You will just screw yourself over by overthinking it and switching your answers when you have the right answer. Who's had that before? Everyone has, right? So that's the easy part. So what happens when it gets sticky? When you still have multiple options, you're stuck between two options, or you have no idea what's going on. So these are the steps I want you to follow. In the heart example, it was easy to eliminate a lot of options, right? If you know what the different organs are. You can eliminate a lot of options, very easy. In the second one, right? It might have been a little more challenging to eliminate options if you did not understand what the different parts were doing. The atrium is part of the heart, right? Superior vena cava connects to the heart. So if you're thinking, oh, that's all part of the heart, you might get stuck there. But really one part is actually doing the ejection of the blood. So you can eliminate those. So the first step is to cross out absurd options. So skin, that's an absurd option. It's not related to what was being asked. You can simply erase that out. But like I said, if you're confused and you still have no idea what's going on, you're stuck between the atrium or ventricle, then how do you then tease that out? So you cross out the observed options, then your next step is to cross out outliers or similar options. So if I was to ask for the average weight of a baby, it's going to fall within a normal range, right? If there's an option that's saying 200 pounds, you can cross that out. In some world, maybe it's possible, right? But definitely not in a standardized test. It's going to fall within expected norms. So anything that seems outrageously out of the norm, cross that out. And then if you have options that are very similar in definition, so let's say a weight of 100 pounds or 102 pounds, you can cross those two out because they're essentially telling you the same information. Usually the correct answer is going to be clearly different from all the other options, right? It's not going to be that close. And then you can cross out always and never options because there's usually some rule or exception to any scenario. So whenever an option just says always or never, you can cross that out. And then your final option, if you still have no answer and you're still stuck between multiple, just come back to it later. Because what happens when you're stuck on a question and you keep reading it, 5 minutes have gone, how are you feeling at this point? Worse. And you start spiraling down. I spend that last question, for example, if a question takes me more than 5 seconds to read, I usually skip it. You can have your different strategies, but guess what? If 80% of the questions were like those first two, I know I'm going to get 80%, right? Remember, you're just passing. If I run out of time, great, I answered the easy ones, but those questions where you're spending too much time on, if you spend your whole time, sure, you get 5 of them right and miss everything else. So if it's taking you too long or you still can't find an answer, leave it, come back to it when you have more time so you don't spiral down into a bad place, right?
Question before we go on. So this is, the test we take is you're talking about taking a test on the computer in the testing center.
Right, so right now this is for the practice. This is you all practicing. Ideally, you are going to practice like you will take it on the exam day, but depending on what you have, what prep course you're using, it might be paper or computer.
Okay, because I was confused. I'm thinking you're talking about us taking the test when we sit down in the testing center, or using words like cross out, underline, circle.
Yeah. So we'll talk about that, right? Because on the exam, you can actually cross out stuff. If you click it, you can do stuff like that. So you do have that functionality. So just replace that with whatever is available. But mentally, it's more of a mental process for you to just be like, okay, I'm crossing this one out, or I'm going to circle this, right?
And you can mark ones to come back to too.
Yeah, so you can mark those, right? So you have those tools to be able to use these, but as you're practicing, it's like taking, if you're a basketball player, you're doing free throws or 3-pointers. It's very boring. You're just repeating the same thing over and over and over again so that it becomes automatic for when you actually have to do it. So once you go on the test day, if you're practicing doing these, it becomes automatic. You don't actually have to do it in your head. You're like, all right, this is unnecessary information. Oh, this is good information. So let's go back to our questions. So this is what that would look like. If we were to cross out, underline, right? So our stem, what the question is actually asking, is this part right here. All the extra information is actually not necessary. It doesn't help you with the question. So if you get caught up in, actually you can take out ambulation. It doesn't even matter what they're doing. So if you get caught up on ambulation, what level of assist are they? What assistive device are they using? Is it in the hallway? Where is it, right? So it doesn't matter. All they're asking for is how should you position a Foley catheter, right? You position it below the level, right? So this one's pretty easy. Is there any other competing option here that looks enticing?
You get stuck on below. Like you get stuck on the concept of below. Below the patient's heart might be like something that draws you to it.
Exactly.
Like,
Yeah.
you know that it needs to be below something, but then you forget where you're placing it.
Exactly. So that's good information, right? And I like how he did that. Because if you're on a question and you're like, why did I actually get this wrong? And you're like, okay, I got stuck on the concept of it being below something, but I just didn't know below what, right? So that lets you know where you're making those errors. Because if another question comes up, you might make a similar mistake. So excellent option there. All of these are real, right? They do mean something, right? Above the patient's heart, what would we use that for? Not, well, specifically.
To measure blood pressure.
Well, like if they're hypotensive and you lift their legs up or something, right? Or if they have edema, you lift it above, below the patient's heart, right? If you have, whatever. They all correlate to something. So it's not that those options are false or fictional. So you might get caught up if you have that concept in your head, but there's only one correct. So I went a little bit narrower here with what I actually, analyzed, right? So that one I highlighted the what here, we can see it's just boiled down. So if we just look at what's highlighted, is that enough to answer the question? We want to know the patient's pulse rate, and we know they have an irregular rhythm. So as you can see, there's a lot of unnecessary information in these exams. And what students will get caught up in is, once again, ambulation activity. What's the Carbonin equation? Are they supposed to be an RP of this, right? And you start thinking about all of these extra information. Did anyone have a hard time with this question? This is a very knowledge-based question. If you don't understand the concept, you would just get it wrong. I don't really think there's a good way to kind of cheat this one. Is there anyone who had an issue with this?
I was just in between the 30 and 60, but I just went with the 60.
Mm-hmm. Yeah, so that's a good place to be, right? You also want to see, what am I actually narrowing it down to? Am I narrowing it down to two very reasonable options, or are you all over the place? So if you narrow it down to 10 or 60 seconds, that's not very good, right? So that's a good place to be, to narrow it down to two possible options.
I can see how, like, at the clinic, if you're in a time crunch and your CI is like, just do 30 seconds, multiply by 2. But that's, we gotta know by the textbook, so.
There we go. I was about to say, what did I say at the start, right?
Yeah.
So you're going to see a lot of stuff, like you're saying, the CI might say that, but this is textbook. So because it's irregular, you want the full minute to get the full idea of what's going on. So which is why I said it's a very knowledge-based concept.
And so, like, irregular isn't really I mean, it's helpful in that it might make you go, wait, I should check for a longer period of time.
That's
irregularity. Like that.
So that's why it's
you to
blue.
go longer.
Right. So remember, we're first underlining, right, or highlighting the stem. This is what it's actually asking for. You're asking for how long you should measure it, right? So it has to be in the seconds. And this is your cue-in that helps you know specifically what you should be measuring for. Because it's fine to do 30 seconds if it's regular, and you can multiply by 2. Because this is also a nice way to study the concept, right? When you're going over it. So let's just take the time to do that. When you have the heart rate, if it's regular, coming in at a specific interval, it's not going to change in 60 seconds. It's still going to be the same. So if you take it for 30 seconds, more than likely it's not going to change. So that's why you can do it. Irregular, 10 seconds, it might be going at a beat of 40 beats per minute. The next second, 60 beats per minute. The next second, 100 beats per minute. It's all over the place, right? So that's why you need to take it for the full minute. And I actually got this one wrong. So I put my mistake on here, right? So I narrowed it down between these two. This is not a concept I'm using in the clinic a lot, so, it's not in my brain. So, but even with that, I don't need to know every single detail. I can still narrow it down. So this is the option here that we have. And I highlighted the parts that's necessary for you. So, did you guys have something similar to this, the important information? We need to know these values we need to know that it's on the quadriceps, and we need to know that it's asking for the hamstrings, right? So then what you need to know is the proper ratio for hamstring to quadriceps strength. Who knows what that is? You guys, most of you got this correct?
I think they consider them all 2 to 1.
2 to 3, right? So you can still get it right if you don't even know, right? So 2 to 3 is the ratio. And this actually does not come out to be exact. But here's what you're going to do. You can divide 2 divided by 3. What's that? 0.67. If we take 64 divided by, 64 divided by 140. What do we get for this? Yeah, you guys have calculators on the exam.
But is it just on the computer itself?
0.45
Or you get it
Uh-huh.
on the calculator?
and 0.6.
So that's why that's your correct answer, right?
I'm stuck up on the screen.
I thought of like 0.60 times 140. That's how I came up with 84.
Yeah, that works. Why'd you get, why, oh, because of the ratio is 0.6?
No, I just saw 60. I'm like, oh, maybe
Oh.
0.6.
So you lucked out. You lucked
Yes, I
out,
lucked
right?
out.
So it's just more of the, that's why I put this, because then if you forget what the isokinetic test is, you forget why it's in those units and what it's even talking about, right? So that's just saying it's moving at a specific angle, right? So that's the set-in, because if it's a different set-in, the ratio goes up. So essentially it's telling you it's the same set-in for both, and in that scenario, what would that be? Right, so you need to know the normal ratio, and then you need to know that ratio comes out to be about 0.6, and then find whichever it should be. These are way too high, and you can see it's 2 points difference, so you can cross those out because they're essentially telling you the same information. Helpful? All right, so then going forth, you want to then analyze. That's our last step. So we know how to go through it. We know how to narrow down our options, right? So we want to know how we can analyze our test reports. What you want to be asking yourself all the time is, why did I get this wrong? Doesn't matter, right? You just want to figure out the trick and what you need to do to get it correct. And when you see what you're getting wrong, why you're getting it wrong, that's your weak point. That's what you're going to work on. And then you're also asking yourself, why is this the correct answer? And within answering that, right, you find out how to solve it, all of that information. You find out how you're going to then answer that question again. Because as you saw with that hard example, same question, just 2 different ways of putting the options, right? We saw the content outline. It's not going to change. The information is there. But the difficulty comes from how it's worded. So find out what the tricks are, why it's correct, and use that. And when you're analyzing, right? First one, yep, got it. What structure pumps blood? Got it, yep. Those categories, very easy, you know it. And then you have those 50-50 options, right? We've talked about some 50-50 scenarios here where it's like, I think it might be this or that. You're not completely lost. You just need to be able to tease it out. And when we work through it, you're like, okay, got it. That moves into the yup section, right? And then there are questions where it's like, nope, I have no clue what this is asking. Nothing's going to change during the exam. You're getting that question wrong. Or right, if you guess correct. So it should fall in each of these categories, right? And roughly, this is where I want you to try to be at. 50% of the questions, you should be able to look at that and be like, yep, I know that. Doesn't mean you're getting it correct. You could get it wrong, but you should still understand and be like, yeah, that's what it is. 30% should be 50-50. Even when you see the answer, you're like, I'm not really even sure how you got it. For example, this one, who did this or who calculated it, right? So you might have not done that, but you still got it correct. You have the general idea, but now you work it, you know the ratio. Next time, you've got it. 20%, I don't expect you all to know everything. I expect you guys to know about 80% of the content. Remember, you have to get between 65 and 72 to pass, correct? So if you're at 80%, that's a great buffer. So 20%, it's okay if you don't know the answer. Does that make sense? So as you're analyzing it, you should analyze all the questions. And half of those, you should be like, yeah, I got it. 30%, okay, I need to work on that a little bit more, but I know where they're going. 20%, it's okay if you don't know at all. So in general, my recommendation is to take 3 practice tests. You've all taken 1. Who here plans on taking more than 3 practice tests? Okay, and there's enough. 4? All right, that's fine, that's fine. And I'm going to show you why I think 3 is the ideal number. The first one is to establish a baseline. I don't really care if you've studied before you take the first one. It's to just show you where you're at. Because once you start analyzing it, it's really going to give you a lot of detail. So don't push up taking the first exam, which you guys have already done. But you should not push up taking the first exam because you don't feel prepared. Take it and see how unprepared you are, right? And then once you have that information and you know what the actual test is going to ask, because once again, it's not what you know. It's not about being knowledgeable. It's about how well you can answer the questions, right? So take that exam and see how well can I answer these questions with the information I know. If you're like, I know a lot of these questions, but I'm just answering them wrong, I'm making mistakes, what do you have to do? What's your strategy?
Be more careful about.
Be more
the
careful.
test.
Exactly. Work on your test taking skills. If you take that and you're like, I knew nothing on there, what do you have to do? Study. So you might be surprised to be like, oh, actually know a good amount of the information, or I don't know as much as I knew. So that's why I think it's important to take that first test, set your baseline, see where you're actually at, because then that's what you're going to work on going forward. Test taking skills or just reviewing material. And then it breaks it down to those sections where you got it wrong. If you're struggling on the MSK, neuro, that's what you're going to focus on, right? And I don't have a set timeline for when you should take the second test, right? There's no set timeline, it just depends on you. But my recommendation, have 80 hours of quality studying. So if you do 20 hours weekly, that's after a month, you can take that second exam. And during that period, you've been working on these weaknesses, right? Whether it's test taking skills or your knowledge. That second test is going to tell you how effective is what I'm doing. I expect at least a 10% to 20% increase in your score if you're doing this correctly. Remember, we're not wasting time on any activity that's not going to improve your score. So if you have 80 hours of quality studying where you're actually doing what needs to improve your score, you should see a 10 to 20% increase. Most students will fail, right? I said. So if you're scoring 55, 10% increase gets you within range. 20% increase definitely gets you above, right? If you're scoring a 55. So you should be passing at this point. And if you're not passing, that's usually an indication you're not doing the right stuff. And if that's the case, you need to find a study group, seek external help, or get a coach, right? Someone who will be able to help you get better with your score. And guess what? Once again, the test is an indication of how well you're studying. So if you're not studying, or you're not studying effectively, there's no point in taking the exam to tell you what you already know, right? You're going to take the exam and score the exact same stuff you scored before. You take the first exam, you see what you need to work on, you work on it, you take the next exam, see how I'm doing, I'm improving, I'm making less mistakes, I know more of the content, what I'm doing is working, keep doing that some more. So think of these as checkpoints, how am I doing? And then the last one is a temperature check. If you're already in the passing range, this is great. This is one more point to see, okay, am I staying consistent? You should at least stay consistent or improve. Because after that second test, you have a better idea of how effective what you're doing is working, and then also what else you need to work on. So with that information, this period between the second and third test is where you hammer down. If you've been scoring poorly, you focus on all of those. You have 2 data points now to tell you what you need to work on. You focus on that, and when you feel prepared, you take that third one and say, am I where I want to be? So I asked you guys what your target score is. At this point, you should be at or above your target score. So that's why I think 3 tests make sense, because you're not just taking the exams just to take them. You're taking them with a specific purpose and say, am I actually improving? Where am I at? Because if you take 4 exams back to back, you didn't study, you didn't do anything in between, like I said, it's telling you what you already knew, right? And for some people, this can be beneficial, but the 4th test is refinement. If you still are not performing where you need to be, this is one more area after you get those 3 data points to say, okay, this is what I need to work on. This other test is then going to say, okay, can I get my score better? Or if you're just being very careful, it's one more checkpoint to say, okay, I'm staying consistent, I'm not dropping my performance, I'm doing good. This can be negative for some people, because what happens if you do bad on this?
Then you know to,
What?
then you know to continue studying.
You've been doing well. You've been scoring like 80%, let's say, on the 3 tests, and now you score 55 on this. Probably freak out, right? Like, oh no, I'm not ready. So it can be detrimental, this 4th test, if you don't do well. But like I said, those are outliers. They're not telling you the full picture. You want to see consistently what you've been doing, right? So you can take that 4th test for sure, but it has its positives and negatives. 3 tests minimum is what I recommend.
I have a question.
Yes.
So we're doing most of the score builders ones. We all had to buy the score builders. Do you think that there's an advantage to also doing like the PEAT test, or do you think score builders is enough of indicative enough of how it's going to be?
Yeah, so the PEAT has a better correlation with you actually passing, and it tends to be more challenging. So if you do well on those, it's a better indication of where you're at. And it's going to depend on who you are as a student, like what you're actually doing. If you're diligent and you can actually stick with a study plan and follow what I'm saying right here, like those 3 exams, especially if you're scoring 80% or above, I think it's fine. You don't need to go into the PEAT. But if you're really struggling, might be beneficial. If you're on the borderline, 60s, right? It might be beneficial to do the PEAT, because then that's really going to tell you, because the score builder tends to be easier. So if you're borderline with the score builders, you might want to just take the PEAT to see, okay, truly what will I possibly score on a harder exam. The PEAT is not necessary, but it can be. It's another data point, right? Once again, all of these exams, they're just data points to tell you how you're doing. What value are you getting from the exam? If it's not giving you any additional value, then I don't really see the need to take it.